Hi, I'm Dr. Pannozzo. Thanks for watching our program. The patients you're going to see are regular patients from my practice. Whatever they say on camera is how they feel and what they want you to know. So enjoy the program, and if you have any questions, write in and we'll answer them. Thank you.
Well, you're from Okeechobee too.
Yes.
Yes, I mean,
Oh, I'm sorry.
so what do you do out there in
Um,
the hinterland?
Well, I'm a dental hygienist, but I don't work in Okeechobee.
Oh, you don't?
No, I work in Fort Pierce. But I've been doing, for the last month, I've been doing CrossFit in Okeechobee, and these are the people that are sending everybody to you, the CrossFit people. But I've had pain for years. I mean, this isn't due to CrossFit, I don't think.
I don't do cross, I don't even do straight.
Okay.
Right, so what kind of trouble are you having?
I'm having chronic pain in down the side of the right side,
Right side of your neck?
right side of my neck, into my shoulder, down to my shoulder blade, and even sometimes right in here. And I get massages pretty regularly, and she actually says the left side is worse than the right, but for me, the pain that I feel that's hindering me is I feel it on the right. The history.
How would she be able to tell you that?
I'm talking about just, I guess, the muscles when
She
she's,
feels it?
well, what I mean is like when she's digging around in the muscles, she says,
Digging?
you know what I mean, you know what I mean? But she says the left side
Don't
feels
tell me
worse.
anything.
Okay.
So what kind of treatments have you had? Just a massage?
I've had massage, I've had chiropractic. That's about it. I've had pain medicine, you know, nothing. I spent a lot of money on a chiropractic treatment, and it didn't do anything but cost me a lot of money. I never stopped hurting.
Yep, well, you should have known that after the first or second treatment.
Well, what he was doing was some kind of traction because I have the curve in my neck, he said, is reversed. And they were trying to put the curve back in. And he would show me x-rays every couple of months that the curve was changing, but that's all.
A couple of months?
Yeah.
Should have been done in a day or two.
Oh, no, just.
Oh, yeah.
Well, I'm just saying it was every couple of months, but.
That's what we did.
But in all of that, it never stopped hurting.
Does it wake you up at night?
Yes.
And how did you get this?
When I was much younger, I had a series of car accidents and
How much younger can you be?
whiplash.
How
I'm
old are you?
not that young, really.
You're 44?
Yeah.
You still got it though, don't worry about it.
Thank you.
Yeah. So your arm's okay, except for here, right?
Right up in here.
Okay, good. Chin down. Way down. Yeah, where does that bother you? How about this side? Does that hurt?
Yeah, right in
Uh-huh.
here.
How about here? Not so much?
Not so
Chin
much.
all the way up? Wow, give me I gotta cut this hair off.
Should I put it up?
No. I'm just making jokes.
Oh, okay.
Well, right there.
Mhm.
Mhm. You notice that that's it right there? C45?
Well, down here too. That's pretty sore.
Mhm.
And aside from all that, I have pain down here too, on the right side.
Wait a minute now.
One first things
Don't
first.
get carried away here.
And plus, you know, what I do for a living, I think aggravates it, honestly.
What?
I'm a hygienist, so I'm hovering over people all day, and I think that aggravates it.
Could very well be. Okay, this is between the fourth and the fifth bone. It's a ligament right here. It's 2 shots for it. But I have to take a picture of it. I have to take a picture because you have more than one spot bothering you.
Okay, good, yeah.
The one between the shoulders
here
down to
hurts
the
a
shoulder
lot.
blade is not from this area. But you have 2.
Something else, okay.
Yeah. This one here, 4 or 5 goes straight down, but the
Mhm.
shoulder blade here comes from lower. Okay, come with me.
Okay.
And when we look at the film, the diagnosis is already made. We're only trying to find out what's affecting it, the structure, the number. So her number is, she has a concavity on the left, and which means the dorsal spine is curved. Doesn't have to mean that, but in this case it does, and it's right here. 1, 2, 3, 4. And that's injured, so that's got a little hook in it. And then she has, looks like her skull is off to the left. You have a headache?
Yes.
You do?
Yes.
Where's your headache?
Do I have one right at this moment?
No,
Oh, I usually get it back in here
at the top?
and then just radiates.
Yeah, well, here's the reason. See your skull?
Yeah.
It's off to the left.
Okay.
Now, where, I'll show you where this headache comes from.
Or
It comes from here
problem, yeah.
or here,
Mm-hmm,
or
yeah.
both.
Yeah, that's
Which
tender
one?
just when you touch it.
Left.
Both, probably. Well, they're both tender, but, yeah.
That's a typical migraine you get, and that's relievable. It's one shot right in it. It's a joint like this, about this big. And then your shoulder blade is hurting because you have a curve right here. So you see her off to that, and off to here. Your shoulder is coming from 7, 6, 5, 4 right there. But you see you're injured on the left. So all the trouble you're having is on the right because the left doesn't move. That's the way it's made. It's a two-sided deal all the time. So when this is stuck like this, scar tissue, not degeneration or anything like that. It's the body's attempt to cure that. And so that doesn't move. The other side moves more, and that's why you have continual pain there. So that stupid chiropractor, get your money back because he absolutely missed this whole thing. Or maybe he knew it anyway and just didn't tell you.
Yeah.
But you can't do anything with that. You have to relieve the left.
So you have to inject on the
You
left?
have to shoot your butt
You shoot the left, and that's going to make the right feel better.
Shoot the left, right, up, down, everything.
Okay, shoot whatever you got to shoot, just make it stop.
Because we have to go here too.
Oh, I'm sure. I'm a mess.
All right, so that's 3. We won't do your headache today. We'll do the rest of it. That's what you came for, right? Or do you want me to do your headache
You
today?
can do it. All of it.
I can't do all of it.
You can't do all of it?
You got to worry about your insurance.
Oh, okay.
See,
Well,
when they ask me why I'm doing all that, you better be there defending me.
yeah, okay. Well, I'm not really sure how that works, so whatever we need to,
Well, I'm
yeah.
telling you how it works.
Okay.
I sent an inquiry, why did you do all this?
Uh-huh.
So if we just, how far away do you live?
An hour and 40 minutes.
Oh, my God.
Is it Lochahatchee?
Okeechobee.
Okeechobee.
I could come next Thursday if I have to.
West Palm Beach. Okeechobee runs.
No,
No.
Okeechobee,
It's
Florida.
a
The
city.
city,
Oh, it's a
Okeechobee.
city.
Yes, yes.
It's inland, right?
Yeah.
It's in the swamp.
Very much so.
Well, anyway, so we got quite a job for us. I'd like to do these two and this one today to get your neck straight.
Okay,
And then next time you come in, we'll take care of your headache.
okay. And what about the lower back?
Where did he go?
I was wondering where he went. I was gonna ask him something, but he's walked out.
He's just getting your medicine.
Yeah, that's what I wanna know, what the medicine is. I'm done with that.
Just ask him when he comes in.
I will. What is the medicine? What are we doing?
I will tell you, or I'll give you a printout.
Okay. in a hurry?
Of course. What about right there? Okay. We'll roll you over into clover. Go ahead.
Ready?
Yep, the other side.
Oh, goodness. That shot down my
Yes.
back. Okay.
Yes, it does.
Okay.
Seen any good rotten teeth lately?
Every day. I work in community health, so you better believe it.
You know how to go around the jug, don't you? Terrific. Okay, you can sit up. All right, how you feeling?
Okay.
Should have relief of this already. Do you? It's just one of those things. How long did you have that?
Pain? Oh, it's years. I don't even know.
Years? Same pain?
Oh, yeah, and it's just gotten worse to where, just in the, last couple of years decided I have to do something. I can't survive.
It's a little magic that we do here.
Still not gonna tell me what it is?
What?
What you put in me?
That's not important. What's important is where and why I use it,
Yeah,
not what.
okay.
All right?
Uh-huh.
He'll give you a printout.
And there you are.
That's what I had.
That's what you, yes. Okay, now we want to do between shoulder blades.
Today?
Yeah, because that controls your neck,
Mhm.
curvature in your neck. Okay. We'll have to have that loose so I can see. We have to go
Am I
in.
sitting down here now?
Yeah, you gotta sit here, chest on the table. Maybe we just lift it up, what do you think?
Well, not maybe.
Yeah, just put your chest up. Now I'm gonna push on several of these, this one, this one,
That one's very cool.
or this one, this one.
That one's the worst, here.
Okay, you're right there. Yeah, we used to sing that Hallelujah all the time.
Oh, really?
Not that one, but other ones.
So you have some practice singing. You acted like you didn't have any experience at all.
Oh, yeah, well, everybody sings, you know.
Good?
Good to go.
Yeah. Does it feel loose in there, or whatever was bothering you there, is it still there? Takes a few minutes. Is there something that you could do before that would, like, make it worse, or that you could do now that you could say, well,
Oh, yeah, that's different. Yeah, I mean, I could do this, but it was painful.
if so it was, and could you go as far as you have as
Oh,
much
no,
range of motion?
absolutely not.
So you have more range of motion and no pain, less pain. cool,
That's
huh?
pretty cool.
Just think of all the time when you went to the chiropractor.
Oh my gosh, and the money that
Irritating.
I had back from that.
Okay. What?
No, I'm just trying
You
to
know.
take it all in.
I wanted to sit down.
Yeah, no, that's
why. How you feeling?
It was good.
Yeah.
Feels weird. Feels a little, but I was just showing him I can do this now without it hurting.
Yeah.
Huh.
Now, for a stretch, you'd seem to be stretching. Stretch only to the right, your ear. Pull your ear down.
Like this?
That's right. Take your hand, pull it. Should feel it on the left. That's the only one you do.
Only stretch this one?
That's right.
Because I do that stretch all the time, but I do both ways.
Yeah, you were doing this way because it's irritating, but you'll keep irritating you if you do that. I want to open the left.
So pull it to the right. Just any time all through the day?
Anytime you think about it. So you see, if you don't think about it, you don't need to do it. In other words, you're curing yourself. That's the kind of exercise you want.
Yeah.
Not to do the same thing all the time.
Yeah.
Boring.
So I can just do normal things now after this? I
Do whatever you want.
whatever I would normally do?
Excuse me. Remember, you still have the COC1 at the top, headache. But I took care of everything else, so just give it enough time, a few days. You can go back next Tuesday if you like, or whenever you're off.
I can come next Thursday afternoon.
Thursday afternoon, okay.
Does that work?
And then we'll knock your headaches off, and then look at your lower back. Okay, you want to say anything nice about me to the camera?
Good job. Very nice guy. Yeah.
You're a hygienist, huh?
Yes.
How come you wear braces all the time?
Because my teeth weren't perfect, and you gotta have perfect teeth if you're gonna be a hygienic.
You do?
Kind of goes with the job description. Oh, see, there I go.
Doing the other side, yeah.
He's right, because I always do that
Yeah, it's a
side.
habit, yeah. So as long as you catch yourself, just keep
Yeah.
doing it to the right.
Okay.
Okay,
done.
well, I want to ask you though,
Yes.
because I just really don't understand. I mean, I just had this MRI and it says I have all kinds of things. So do I not have those things?
You don't.
I don't have herniated disc and it says I have a cyst
You have no herniated
at 6
disc.
and 7?
No, you don't.
No?
I just looked at it.
But you can see that? Well, I'm not questioning you like I'm doubting you. I'm just questioning because I don't understand.
An MRI is useless for what you had. They misdiagnosis completely. You can't tell what you have based on that. You have to be clinically examined. That's why.
Okay. So I don't have herniated disc and I don't have
No,
a cyst at 6 and 7, it said?
no, you do
Okay.
not. I didn't see it.
Yeah.
If you want to believe them, go ahead.
No, you
That's
hear
why I
all
look
these
at-
things.
That's why I look at my own films, because reading those do not treat you. They don't have an examination for you.
Mhm.
So you were diagnosed before you even had a film. You go in there and they have no idea what they're looking at. They just look and, no, it's not connected to anything. See, my film's connected to this. That's your diagnosis, C45 annulus, so that's what we did.
Okay.
So, it's a big difference. This is a quality approach. It's a physician approach. It's not a test like, say, you gotta remember that. You got the best you can get right there.
Okay.
Ta-da!
Yay!
There he is.
I make it the best you can get, because then I can charge a high amount.
Oh, no.
Thank you.
Who are you?
I'm Roger.
I've never seen you in my life. Here, sir. Hit my head.
Oh,
It's a good way to knock the building down,
oh my
Slide that
God.
one. Where do you live?
I live in Boynton Beach.
You didn't sign here? How old are you?
I'm 17.
Not able to sign, is he?
Yeah, I already signed it.
He's 17.
I signed for
No, there's another one.
Oh,
that
my own?
Yeah. All kinds of places. That's it?
That's it.
I don't
Short,
believe it.
short signature.
Can you write your name?
You want my name?
Can you write your name?
You do it with my name?
Yeah, write your name.
Okay.
Oh, and you have to put all that down to write your name?
Yes. That's the
You should
most,
see his signature.
No, you don't write his name. You have-
No,
my name,
You're the guardian. You're the mother, right?
yes.
Okay, you're the guardian then. Okay.
Okay.
Yeah, look how trouble you had.
I just look at my shoulder. Like,
I'll get you something.
Okay.
it's like, I'm concerned. I even hurting me.
Yeah, you should be concerned.
Yes.
What are you trying to do with it?
I'm trying to heal it. Pretty much. Get better.
You've had pain with it for how long?
I've been, like, I just look at, it first started since like the first week of August, like for training camp, then I kept like injuring and playing on it. And like that, like a couple days ago, I was just sitting there and like the pain just started coming down to the ER.
So it's just since August then,
Yeah, from August.
This year?
Up until now.
August what?
I should say the
Early, middle?
First week football practice was August 1st. I should say I
August
injured it
1st?
August 2nd or 3rd. And then it just kept coming out from there.
Okay, can you lay on it?
Sometimes I sleep on it.
Can you sleep on it?
Yeah, I can lay on it.
Okay. And does your neck hurt?
Sometimes I be pain like where the vein at. Like,
Right there?
Yeah.
And you, how about your left arm?
And then pain.
That's your shoulder, but the arm.
Oh, that's what I'm really working on.
Okay, I'm asking
Oh,
about
my
your
arm,
arm. Does your arm hurt? Yes, no?
arm, that's it.
Okay, no? And have you had any treatments on this?
I went to physical therapy like 3 times.
And who ordered that?
I went to urgent care and they referred me to go to the physical therapy.
Urgent care.
Yes, sir.
Hmm. They should have sent you here, not to physical therapy. So dropped your care. You didn't get any care there.
I didn't really get a lot.
Hmm?
They treated me, but it wasn't really much to help.
What did they do?
When I was basically doing the same thing over and over again, like resisting bands, internal,
That?
external,
Just that?
yeah, forward and back, stuff like that,
That's all? That's your whole program?
basically.
Basically?
Yeah. Nothing more than that. They just did STEM one day.
STEM?
Yeah.
Okay. Well, I'll take a look at it. Do you want to be a pitcher?
No, I play football.
You play football?
Yes, sir.
That's why you play football.
He's
You
going,
right-handed?
Yeah, I'm right-handed.
he said you're going to university of what
I'm
next
going
year?
to Kent State University next year.
Ohio,
In Ohio.
Ohio State.
That's what Dr. Pannozzo.
What school was that?
Really?
I'm going to Kent State University.
Kent.
Yes, sir.
I know all about Kent. All right. All right, let's see your shoulder. Drop your elbow in my hand. I'm gonna turn it, so don't help me today.
Does that hurt? It's not going up, does it hurt? Yes, no?
Nah,
Speak.
a little bit.
Okay. Yes, these are yes or no's, not a little bit, no much.
Yeah,
Yes
just yes or no, that's all. You need to talk.
Yes.
Which is worse, going up, going under, or going down, hurts you more back here, right?
In the front.
It hurts in the front. Okay. Hold your hand, elbow right here, don't let me push it down, hold it up. That's good. All right. You've had this for a while, haven't you?
Sir.
Yeah, let's see this. You know? Decidedly better, isn't it?
Yes, sir.
All right. You have ligament troubles here. Front and back. The whole thing is surrounded by ligaments, those bones. And when you hurt one, they restrict motion because it's painful. So we have to reverse that.
Yes, sir.
And we do it by shot.
I shot.
Shot.
No problem.
Oh, good. That's good, because there is no other answer. You want that. And when you have to get back on the
Field.
field,
There's really no rush. But
you're
that's
going next year, right?
I'm going to Kent State next year, but I play varsity football
Next year, okay.
at Village Academy at my high school.
And which academy?
Village Academy.
And Dairy Beach.
On
and
12th
12
Avenue.
Avenue.
On
It's called Village?
Yeah,
Village Academy.
Village Academy.
Never heard.
Village,
Yeah, it's in
It's like
12
art school.
Avenue in Atlantic.
Village Academy, what street?
When you go there,
On 12th.
12th Street,
On the
for
southwest.
Atlantic, it's for the Atlantic.
private school.
It's a choice. It's a choice school, but a lot of people see it as a private school.
Just study hard, don't worry about the football.
So
Don't worry about football. He like football.
You got a scholarship?
I have
Yeah.
6 Division I scholarships.
That's, you gotta be really good to get that.
What position do you play?
I play offense and defense. On offense, I play running back. On
I knew
defense,
you were running back.
on defense, I play either corner, safety, depending on the packages.
Well, we can fix you up, there's no question about that. Put your chin straight down. Go ahead, down.
Down,
Does
no.
it hurt? Which side?
Left.
Left. And chin all the way up now, way back. Does that hurt?
No.
Chin on your right shoulder? Does that hurt?
A little back. Back.
And the other way?
To the long left.
So we got more problems than that. You got a neck problem too.
Crappy.
This one?
This one on the vein.
This one hurt? Or this one? Or this one?
In the middle.
This one? Or this one?
Right there.
This one. This one goes down to the arm, you know.
Yeah, that's what.
You don't have that, do you? Down to the arm.
Yeah, we should. And what time is it? Almost 30.
All right. We're gonna save your scholarship. Don't go to those guys over there. At Kent, don't ever go to those guys.
Yeah,
They'll put you in all kinds of dumb things.
Yes, sir.
Yeah, okay, so we'll fix you up before you go. All right, come with me. Oh, man. C5-6. Can't see anything. It's just a barely narrow.
Yeah.
Your neck looks good if you want to see it. Okay, looks good. It's a little bit hooked there, but the problem you're having is a 765 right there.
Can't see anything there, but that's.
No, I got you, cause like, I be looking and like, my left collar, like my right collarbone comes out more.
No, it isn't. No,
You
you're,
see, you see? Not the
you're
doctor.
straight.
Not the doctor.
Quit looking at yourself.
Not the doctor. I'm gonna make commercial for you.
The sandals in the way.
I'll go where I go. And there it is. Don't bother me now, I'm busy.
Every time we get in this room, that phone rings.
Every time.
I swear.
Dr. Pannozzo.
What's that? Three to five.
No, I'm ready to give it a shot right now. Only 5 minutes.
It's already done. Here, get it?
Thank you.
All right, you can move it. See, that went in the scar tissue right
You can sit.
there. This was okay until I moved it up a little bit. Then I keep that's right under there where the shot went, is where the scar tissue is.
What, you put me in the phone?
Yeah, you can take a picture of it. Show that to the trainers or wherever you go.
It's not bad. It's bad or not?
Yeah, it's fixed. Secure.
So,
She doesn't believe we could fix this in one day.
Can you move your arm around?
yes, sir.
Could you
Move
do
it
that
straight
before
up.
you came in? Can you back up a little bit more?
Can you go that way so I can go?
Yeah, can you?
I can't believe it.
And then do what you just did. So could you do that before you came in?
Yes, sir. There's a little restriction. Not move my arm. Rotate.
Kinda hard to believe, huh?
Yeah.
But it's the truth.
Because I don't think they're being treated properly.
I'm sure of that.
Oh, yeah. How you get in a situation like this? I mean, you shouldn't. You can't even move your neck. So far, we have spectacular cures. You can't believe it. I don't even believe it, I'm looking at it.
Oh, yeah? Wow.
Not a lot of people,
Well,
but just,
in any place Glenn takes his mom to, you gotta have faith in it, because that's
Oh, yeah, we did fix
her
her.
knee, I think, yeah.
Which, her back too.
Oh, yeah.
Yeah, which zip code do you have?
33486.
Did you sign this? I guess that's you then.
Yeah, I gotta work on my signature a little bit.
No, it's him.
Oh,
You gotta sign.
mine too. Oh,
How old are you?
yeah. 17. I just turned 17.
It's a dangerous age.
You didn't tell me about it.
17
I got a
and
I got a 19 too.
17 to 19 are dangerous ages. So you've been pretty healthy ever since, right?
Mm-hmm.
Pretty lucky, very, very lucky.
I'm gonna change
Oh,
the
I
tape.
didn't.
Behind my left, like behind my left head.
That's exactly where it is. You
that's-
found it.
Yeah.
How long you been having trouble with this?
3 months,
Yeah,
4 months.
Yeah, but it got worse ever since that one night on the bus when my neck got stiff.
And how did you get this?
The pain?
The injury? How'd you
Oh,
get
the
it?
injury, because I had to sleep overnight and with my head in one position.
So 4 months ago.
No, it gradually came up.
Wasn't an accident, auto accident?
No.
Not that we know of.
But it wasn't
any
back
trauma.
then. There was no pain. It was just like slight.
Does your neck hurt?
No, but like it just feels tight. There's stuff like everything in there.
And does it go in your arm?
No.
Okay, let's see what we can see if anything. You gotta have to put your chin straight down. All the way down. I'm looking for a pain. Do you have a pain anywhere?
No.
What about here?
Nope.
And here?
Nope.
It's got a bulge on the right. I think it's curved a little bit. Okay, chin all the way up? Way up? Way up. Does that hurt?
No.
And put your chin right here? And here? Any of that hurt?
No.
Nothing?
Nope.
Hmm.
So let me tell you what the pediatric neurologist said. He said, there's nothing wrong with them. It'll go away. Could be up to 2 years. Thanks, Doc. That's really helpful.
2 years.
Yeah.
Okay, let me show you where I think it is. You tell me if I'm right or not. I think it's right here.
Yeah.
Is this where you said?
Yep.
Yeah, right there. See, that's COC1, that's the top bone that meets with the skull. And that's where all these veins are. Headache, vertigo.
And is his swollen, Doc? Is that inflamed?
The other doctor said that it was a little swollen after it. I don't know.
It's surrounded by ligaments, so it's a ligament problem.
Okay.
A ligament injury. It's the same as you do in your finger or your knee or anything else. It just happens to be there. And I did the research on this, is what I know.
Really?
Even going to the anatomy lab, let's see what's in there. And so.
Cutting some people up and, or
Cadavers.
they were already up, they were already
They were
cut.
already,
Yeah.
they were already out of it.
Nobody
Right,
complains.
Right.
So, just drop your elbow on my hand. There you go. And that's good.
Tell them if there's any pain in your
And your elbow's straight. Tell me what happens to it.
Oh, my elbow? Oh, it's like
Give them the pop.
Oh, yeah, there's a, relax here. There's a joint right there.
and it's
Is
done.
that where it is?
Yeah, I think so.
Right there.
I mean, I've felt it for like a couple of years now.
Is that it
But it doesn't
then?
really do anything.
That's it then?
I think
Shoulder's
so.
good?
Yeah,
No,
yeah, that's
no,
it.
the shoulder.
Oh, yeah, the
shoulder's
shoulder is the
more-
yeah, my elbow's
worse
fine,
off
it's just
than
my
the-
shoulder.
The shoulder?
Yeah,
I
ever
haven't
since
seen
I
it
did
on
some
the shoulder.
Yeah. No, it's when I throw something, it aches.
Yeah, it's got ache now. How about
Recently,
that?
it's gotten a little better.
Doesn't
Now
go,
it's fine.
doesn't go good.
Yeah, that's
You
fine.
notice that?
It doesn't what?
Doesn't go under. Scratch your back with that arm. See where it goes?
Mm-hmm.
Does this one go as much?
No, it's
Not as, it doesn't, it feels tighter.
It has to be right here. Is that sore?
A little bit.
Yeah, that's it.
Yeah, that's where I felt it too earlier.
When
I was like-
Back of the shoulder. Now, we have to take a picture of the neck, and come on.
Okay.
You feel that on the left side, don't you? Okay, come in. Don't block your dad, he's gotta see this. You see how his skull's off to the left?
Yep.
It's got a little bit, doesn't look like a curve, maybe a slight curve.
Little bulge on the right.
So the head's resting on the left side, there's a joint there.
Gotcha.
So if you'll take a shot there, I'll relieve that today for you.
Literally.
Yes.
You
We don't
good?
mince words here.
You good?
Whatever you hear is what you get.
Okay. All right.
Not like some places. They use all kinds of words, you don't even know what they're talking about.
Right.
And I can do that elbow too.
Shoulder is fine, you're saying? We don't.
No, the back of the shoulder has to have a shot.
Yeah.
Yep.
Do we get a 3-for-1? Is there a 3-for-1 bonus?
No, it's 3 plus, 3 times. What are you talking about, 3
okay. And what Glenn was saying, the drug that you use is Decadron?
Yeah.
Okay. Basically a cortisone, right?
Well, it's very refined. It's the only thing I use on myself. It doesn't hang around, very short acting. That's what you want.
Yep.
So in other words, he could do a little runs tomorrow, there's nothing in there. Gone.
Great. So this isn't gonna take 2 years to get better with? I tried to maintain, I actually did a pretty good job of maintaining, and he just, and the guy just said, he just has to relax.
Who was that?
Neurologist.
A neurologist.
Pediatric neurologist.
They have no concept of musculoskeletal. They treat nerve diseases. This
Yep,
is not
yep,
a nerve
yep.
disease.
Well,
This is my business.
I knew that walking out of there. It was ridiculous.
See? Pretty smart, huh? I created my own business.
Yeah.
Put your chest here. Forehead on your wrist. Forehead on your wrist.
Let us know, Alex, if you're all right.
Just breathe.
Relax and breathe, kiddo.
Yeah, give him a cookie.
He likes cookies.
A little pinch now. Boy, that went all the way in there because he's so big.
You okay, kiddo?
Lay
Yeah,
down.
fine. Still all right?
Yeah.
No bad reaction to the, keep talking to me.
I'm fine.
Stay with your head down. You think he's got some more to do here.
Oh, you can lay down. No. There is no reaction to this. This is what we give for reactions.
My business partner's a neuroradiologist.
Oh, is that right?
Good friend of mine, and I asked him about the whole process, and he said, there's pretty much nothing to worry about with it.
Well, that's good because,
That's a good drug.
yeah, it's a good, very good drug. I'm surprised you didn't call me though.
I think you might be getting a call from him if this goes the way it seems. And he'll be sending you some people probably.
That would be nice.
He's a great guy.
Right there, isn't it?
Yeah.
Okay, now sit up. And let me have your shirt. I gotta go back here. There you go. Now bring your elbow way up with the other hand. Your hand pretty way up. Up more because I can't feel it yet.
Stretch it out, Alex.
It's gotta be the worst right there, right?
Yeah.
All right, kiddo?
Yep.
Hey,
harder for me to watch than for you to take.
Well, if you don't look, it's fine.
You good? Why don't you
Yeah.
lay down for a second?
No, I feel fine.
Is he bleeding in the?
Yeah, he's bleeding in the back.
Okay. No worries. That might make him pass out.
We haven't had anybody pass out from this yet.
No?
Except one lady that almost passed out.
Well, I guarantee
See if
you,
you
I
can
bring my
move
daughter
your
in,
head
she's passing out. She
where-
looks at a needle, she passes
Does it
out.
feel
Yeah.
looser now, or
Yeah. Mhm.
whatever you came in for?
Feel different?
Yeah, it feels like
Relieved?
a little bit, yeah.
See how your elbow is, see if you can, you might still get that pop, but
Mhm.
Okay, hold on
it's gonna
before
create,
you, put your shirt on. Yeah, there's nothing, I don't want you to get blood on it.
Oh, yeah. It's my elbow though, oh, wait, no, it won't get on my elbow.
You're good. Is there a possibility, doctor, that he needs a follow-up, or we should be good?
only if it's pain.
Only if it continues. Okay. Well, he's got a game today, so can he throw, should he refrain from any throwing today?
You can't hurt yourself, but you can only, it's gonna go away no matter what you do.
Okay.
All right.
If you wanna take off, do it.
Okay.
So take
Well,
a day,
yeah.
take a
Don't
day
want to work
off.
that hard.
I'll just throw lightly today since I'm gonna throw tomorrow, but just loose, not much.
You can go and throw some balls if you want, just to get in the action. But-
Oh,
Okay.
All right, so, how do you feel?
feel good.
Are they gone?
It feels less though. Yeah, not as much. Like before it was, I felt pretty.
So you feel a difference?
Yeah, I feel different.
And it'll continue to relax?
Absolutely.
Yeah.
Overnight.
All right.
So he's cured.
Huh?
He's cured, don't come back. See ya.
Thank you, guys.
Thank you.
This has been bothering him for months, guys, so. We really appreciate, it was a
Make
long-
sure this is where you come back on, if anything
Yeah.
happens, this is
Okay.
the place to come to.
Perfect.
All right.
Have a great
You
game.
too.
I wrote a letter to Medicare about you. They paid your bill.
They pay. And I send paper also for you to my attorney. It's not finished yet, my car accident.
Oh, really?
Yes. I have to continue everything to fix.
But you are fixed.
We fix.
Medicare wants all that money back.
Medicare takes my money back when?
Medicare, yeah.
Yeah.
Everything they paid, they want it back.
Yeah.
Because it's an auto accident. What was that?
No, it was 2 years ago, not new accident.
Oh, it had nothing to do with this?
No, it's not new accident. It's last.
There was
It
something
was
flying.
2014.
Did you bring that in? I think they're
2014.
chasing you. Hey, what do we do for you today?
But I have pain in my hand. I can't
Hands?
sleep. Yeah, hand.
Yeah.
It's become numb at night. And I can't sleep on the right side. I can't sleep because it's pain. But if I lay
Does the
down,
shoulder
look
hurt you
that-
too?
But yeah, if I lay down, what look like? I can't sleep. But on my shoulder, no. It's pain going here, look like under my shoulder, what under my scapula. Something what here, under, around. And if I lay down also to left side, my hand also numb.
How old is this? This is new.
It's, no, we did, before I had also first time when I came, you put for me shots, it was okay for a while. And now it become once again.
We didn't treat you right.
I have one shot in my neck. Maybe it was not enough.
We never got it.
No, maybe not.
That was just your back.
No, but I had lots of pain in my right leg. It's disappeared. Now it's every good, everything okay. And before I had also a headache all the time.
Yes, you did. You had 2 shots in your neck,
Yeah,
April 16.
what? And I had a headache all the time. Before I can't sleep, I have a headache, big headache, several days.
April 6th.
Yeah, after treatment, it's everything disappeared and my eye now is better. I
She can see better,
read.
she said.
I can read some, yeah. I didn't read before without glasses at all, now I can read a little bit, but it's different. And now I feel my body. Before I didn't feel my body. I didn't feel where is pain in my hand, in my leg. I didn't feel just pain, something. And now it's different.
You come to the right place.
Yeah. But I have to finish.
Yep.
Finish. I have to go to skiing to Michigan for 3 months, and after that I'm going to Master World Cup. I must to be prepared to Switzerland
You're gonna ski?
for skiing.
You're skiing in
Cross
Switzerland?
country ski.
You're gonna ski for your country?
Cross country.
Cross country, yeah.
Cross country ski.
That's
Yeah.
hard.
There's a lot of snow over there. You sure you want to go?
Yeah. Mm. But I can lose my hand.
Which fingers go numb? These two or these three?
It's numb, everything numb, yeah.
How about up here?
Numb here. This is okay, but something here. And what you see, I have even want something here. Now this is I don't have. Something with my hand.
Yeah, your hand's good. Let's see your shoulder. Hold it up here. Hold it. Hold it up. Okay. All right, that doesn't do it. This was injected already. C5-6. This was not. 6-7. How about that?
Yeah.
That hurt you right there.
Mhm.
6-7.
Sometimes no pain, most of the time I have. I'm working also all the time.
Well, these are very subtle. I mean, that you could have not much to show. You can have symptoms without showing that much. You have to know how to find it. All right, it's 2 shots if you want them.
Okay,
Okay, lay down. On your side.
on my side.
He's gonna do both sides, so we'll do that side
Okay.
first.
Yeah, it's much better. I have to finish my jobs. My treatment I have to finish.
Yeah, you have to be proactive.
Mm-hmm. It's miracle. I went I was visiting lots of doctors.
How many different doctors you know?
Oh, many.
Like
Only
chiropractor,
a chiropractor, a massage therapist,
massage therapy,
and orthopedic doctors, 3 of them.
surgeons?
Surgeons, and they put from pain also across the street, women over there.
Across the street from here?
Yeah, and everyone puts for me shot, cortisone everywhere.
Everybody put cortisone,
Yeah,
and it didn't work.
nothing helps.
Well, that's all good information.
What?
She went to all these different doctors, like,
Oh, lots
even across the
of
street, had cortisone by all of
Across
them,
the street?
and none of it
Across the
worked.
street,
None of it
pain
worked.
doctor over there. It was many years ago.
Came here and got results. You should change your name to Dr. Anthony Results.
Oh,
Anthony Results, Pannozzo.
oh, it's in my hand. Oh. I feel.
They used to
my
call me
hand.
Dr. Feelgood. That's when Elvis Presley and those guys were getting prescriptions
Oh.
to make them feel good. You know? So they used to call me Dr. Feelgood.
One doctor told me I need surgery in my neck and my lower back. 2 surgeries one day.
Okay, turn over. I'll treat the other side. You getting relief already?
What?
Is that arm feeling better already?
Yeah. I feel in my but it's not. I feel in my hand, yeah. I'm ready.
You can get up, just get up slow.
Yeah?
Yeah.
Oh,
Just make sure you're not dizzy. So you can even test your arm out, see if you can. No, that's what he wants. He's gonna want you to do that.
yeah, but yeah, I feel only shut here and I feel.
So you feel better.
Mhm. I feel.
Can you move up
Oh
and
yeah. I move.
do your little victory dance? Okay.
Yeah, I hope it will be much better. Something will happen. Never know from what.
Life.
Life. Okay?
Ask him. I think you're all set.
Is everything done? For a while.
Didn't get hurt again.
Yeah.
Wanted you to meet my friend who's a real golfer, and he's been through our training program. We took care of his swing, his pain on his swing, and now he can hit the ball. Right? But seriously, we have a golf program that does take the pain off of your golf swing. So if you're having trouble swinging and you're trying to going through the lessons, trying to get your swing better, remember, our principles are do not change the swing, bring it back to normal. And if it's not normal, it's because there's a pain involved. The swing at the tee is very, very complex, and that needs medical treatment. The other swings that you use on the fairway and putting is a limited swing and will not be affected.